Hello AP students, this is Mrs. Politsky and I have notes for Chapter 12, Psychological Disorders, and we're going to speak about developmental disorders. And there are really three big ones that we're going to kind of hit on. We're going to talk about autism spectrum disorder, dyslexia, and attention deficit hyperactivity disorder, also better known as ADHD. So, these are problems, for the most part, that develop or appear at any age, but severe common ones are seen primarily in childhood. And the first one is the autism spectrum disorder. Just a few years ago, this was just known as autism, but since the new edition of the DSM number 5, we're kind of referring to this as autism spectrum disorder, or you may hear it by the acronym ASD. This is a developmental disorder that's marked by disabilities in language, social interaction, and the ability to understand another person's state of mind. The autistic child lacks what we call a theory of the mind. Severely autistic children cannot imagine themselves in someone else's place, believing something that they know is not the case. The autistic child has difficulty in social relationships, usually existing in a world of extreme social isolation. Most autistic persons also have language difficulties. Many never achieve functional language at all, and many are classified as mentally retarded. Some may engage in self-stimulation. Sometimes this is known as stimming. This could be banging your head, or flapping your arms, or fidgeting. Some display repetitive behaviors such as rocking, back and forth, all of which are things that help them kind of relax at times. In many cases, an individual who's self-stimulating probably doesn't even realize that they're doing that. Autism occurs 1 in every 500 children, at least according to your textbook at the time it was published, but the CDC, Center for Disease Control, has done a lot of research on this in the last decade, and the numbers are changing. They're saying that it's likely 1 in every 68 children probably is on the spectrum. They may not necessarily show the most profane of difficulties, such as the inability to speak or the inability to look at someone, but probably 1 in 68 people are probably somewhere on the spectrum, meaning that they could be very mildly impacted by this. So there's a pretty good chance that you're going to run across an individual in your work environment or in your school that has this. Often when we talk about the diagnosis of this disorder, sometimes it's first seen roughly about the time the child is about 18 months to roughly 2 years of age, about the time that language is developing. But there are individuals that are on the spectrum that don't necessarily have their symptoms manifest until a little bit later. Autism and fundamental brain disorder, or is a fundamental brain disorder with a genetic basis. At this moment in time, there's really not necessarily a concrete theory on exactly how this happens, but there is some belief that there may be something genetically because there is a pattern within families. At the moment, there is no cure, but there are a lot of treatments that are available to help individuals. Our next disorder is dyslexia. This is a reading disability thought by some experts to involve a brain disorder. This impacts about 1 in every 5 children to some degree, often leading to poor school performance. It often leads to a diminished self-esteem and eventually a loss to career opportunities. Dyslexia is not a visual disorder, regardless of what some people think. It doesn't necessarily cause letters to jump around or reverse themselves. Research over the last 15 years suggests that instead that the disorder involves abnormalities in language processing circuits. So we're probably looking at some issues that are happening in the left frontal lobe, possibly the temporal lobe. There is no marker that sets a dyslexic individual entirely apart from others who are merely average readers. A dyslexia diagnosis may arbitrarily define a group of people occupying a lower end of the reading ability spectrum. Even smart people like Albert Einstein can have dyslexia. One of the things that they are doing is they're playing around with certain colors. Individuals who have dyslexia sometimes may use purple tinted glasses, or perhaps maybe even like a transparent folder that is colored purple, or purple paper, because they're finding that that actually is very helpful for certain readers. Our final disability is attention deficit hyperactivity disorder, or ADHD. Now, there are some different attention disorders that are out there. You may hear of ADD, which is an attention deficit disorder, but it does not have the hyperactivity element that is to it. So when we talk about ADHD, it is a developmental disability involving short attention spans, distractibility, and an extreme difficulty remaining inactive for a period of time. These are typically among children who have a problem sitting still or staying focused on a task, such as involving math problems or listening to directions from a teacher. These individuals may experience distracting problems at home, or abuse from peers, or merely a cultural tradition that places a low value on tasks that demands remain quiet. This disorder is estimated to affect somewhere between 3 to roughly 5% of school-age children. This diagnosis is kind of controversial because a lot of critics claim that it's overdiagnosed, primarily in boys. Careful studies have demonstrated that properly administered drug therapy along with behavioral therapy can improve attention and diminish the hyperactivity in a majority, or so much 70% of individuals who are diagnosed with ADHD. Thank you very much.